Hello, everyone. My name is Jack Crompton. I'm the Mayor of Whistler, and I'm here with Dr. Karen Kausky, and we are going to talk COVID-19. Welcome, Dr. Kausky. Thanks for joining us today.
Thanks for having me, Jack.
Let's start with where we find ourselves. We had a significant surge of COVID-19 cases here in Whistler through January and February this month. What are you seeing now in terms of testing and positive cases in our community?
So thankfully, we are seeing fewer people for testing and fewer positives. Positivity rate is lower as well, the number of people that test positive. But we're still seeing daily positives and still seeing, 20 to 30 to 35 people a day that are getting assessed and tested.
And what's your message to our community about our current response to COVID-19 and what's the prescription to Whistler?
Oh, the prescription everybody is very weary of because it's just more of the same. And I totally understand everybody's fatigue for this. But we do really need to get those numbers down. That spike had a really compelling effect on our community, and those numbers were big. So we do need to get it down even further, especially with the concern about the variants now circulating. So really the prescription's the same: to wear a mask, to socially distance, to not socialize indoors, wash your hands, don't touch your face, keep your bubble just to the people that you live with, and don't go to work if you're unwell. Get tested.
But you get to add one piece to the prescription, as we were talking about earlier. What's the additional piece to the prescription?
That is true. So BC now has a COVID vaccine plan, and we're currently in phase 1, but transitioning to phase 2, and phase 2 will be where we start immunizing community members. The first cohort will be anybody over 80. And so now we can get vaccinated.
Great. What would you say to someone who's afraid to come in and get tested for COVID-19? Maybe they're worried that their housemates will be mad or their family will all have to self-isolate together. Why should someone get tested?
It's a really common fear and something I hear a lot. People are worried that they'll be responsible for everybody else isolating. But the fact of the matter is, you'll be responsible for a lot more if you wait. So getting tested just gives you a piece of information, and then you act appropriately on that piece of information. I mean, you may test negative, and that's an important piece of information to have. It's really important to get tested early on, because one person that goes to work, that meets up with friends, can spread COVID to lots of different cohorts. And so really, really important to get tested. And there is definitely no shame around testing positive for COVID.
Talk to me about the variants of concern and what they mean for how our community should respond to COVID in our current context.
So we have now several different variants of concern, an African one, the UK one, a Brazilian one. And what's important about them, there's lots more variants than that, and we expect RNA viruses to mutate. But these are particularly concerning because we have found them in BC, and as I understand, they appear to be much more easily transmitted, and we think may even lead to more severe disease. So if we think of our surge in January, to multiply that by 10 would really be concerning.
I've thought of it as a real motivator to keep our COVID guard up, because those variants could move quickly, and that would mean that we could find ourselves very quickly back in the kind of position that we were a week ago, which would be challenging. As we head into this weekend, what do we need to focus on to keep seeing a decrease in COVID-19 cases in Whistler?
so again, it's really more of the same. We really need to socially distance. We really need to wear masks. We really need to not socialize indoors. I think the big thing is, I talk to a lot of people every day that say, but do you think that some particular situation's okay? That's a little bit off of exactly what the public health guidance is. And my standard response has become that if you think that's going to get us out of this situation faster, I think you should do it. And most people, when you frame it that way, are pretty certain it's not going to get us out of the situation faster.
That makes a lot of sense to me. Finally, talk to us about COVID fatigue and how we as a community and individuals can respond to feeling tired of this.
I think just basic self-care, like just everybody needs to get outside every day. Everybody needs to exercise every day. We can still connect with friends, with family. It's harder and it's not as satisfying, but I think we need to keep making that effort and doing all of those things that do spark some joy in our lives.
My mom always told me that the one thing you should always add when giving advice is, and call your mother. So call your mother.
My mom will love you for saying that.
And I just want to finish with a bit of an ad. We just had a wonderful hour-long conversation with you on the Whistler podcast, which will be released next week. And I'd encourage people to tune in. It was a lot of fun. Obviously, it's a heavy subject to talk through COVID-19 and where we've been and where we're going, but I really enjoyed it. So to those people tuning in right now, have a listen. And to you, Dr. Kausky, thank you for your time to chat to us this afternoon. Appreciate it very much.
Thank you, Jack.